Good morning, everyone, and welcome to your site meeting. Today, I'd like to do a little bit of a review and some discussion about our Epic transition. As all of you know, or hopefully you know, that we will be going live with Epic on April 20th, which is a Saturday. And I know you've seen several emails related to that weekend and what's going to happen, but I wanted to talk a little bit about Epic. First of all, I think a lot of folks might believe that Epic is an IT project, but it really is an organizational change. And so I just want everyone to consider that as we move forward, because there's going to be a lot of changes that we have to make to our workflows. And it really is an opportunity for us as an organization to grow and improve. So what does it look like for us? So first of all, while you're doing your training, and I know everyone is diligently doing your training, I want you to know that the trainings were not designed specifically for FQACs. So sometimes you're going to see things in the training and think, oh gosh, I don't do that, or we don't do that here. And it's very possible that that's the case. So it's always important that if you see something that you ask questions, whether it's the instructor or even talk to your site manager or nurse manager to get clarification. The second thing I just want to talk about is that there's a lot of change that you're seeing in these trainings, and there's a lot of opportunity for us to automate a lot of the things that we're doing manually right now. It might seem a little bit scary, and change can be that way for some people, but we really encourage you to embrace that change. And again, always ask questions if you're not sure. So I want to talk a little bit about the support that's going to come forward for our Go Live. So first, some of you may have heard, we will have a Go Live appointment conversion weekend. That will be the 6th and 7th of April. And that will be involving our reception and call center staff and our site managers. And they will be coming in to make sure all of the appointments come across appropriately so all our patients continue to be seen. Then we move into April 20th, as I said before, which is our Go Live date. What does that mean? Well, first of all, what that means is on that day and that entire week, we will start 1 hour later for appointments. Your time to come into work will be the same as it normally is. But to give the Epic team or the HCN team time to come in and get organized to help support us, they want us to have a little bit of extra time first thing in the morning. So I just mentioned support. So what does that support look like? So first of all, at all of our sites, we have super users. And I want to say hats off to the super users. You've gone through the training twice, and thank you for stepping up to be those volunteers. Second, besides the super users, you will also have HCN, this is Health Choice Network staff at your location. There will be approximately 2 people at each site to really kind of help provide some additional support and technical assistance. Next, here at admin, we will have what we call a mini command center, and there'll be 3 HCN executive staff level, as well as myself and Joey in the mini command center to help troubleshoot and assist the sites. From there, we will have a 15 or 16 person command center in Miami with the HCN staff providing us additional support. There will be a workflow to submit tickets for any technical issues we have that we cannot solve on site. So I want everyone to know that yes, there will be challenges. There will probably be some bumps, but we will have lots of people here to try to help and support. And so I know there's been a little bit of anxiety out there, but I just want you to know that we know and understand that this is a big change, and we are doing everything we can to make sure that everyone feels supported. The other thing I want to share is that as we go through this change, we are wanting to have some fun. And so during that week, we want to provide some snacks, some food, and we just want to acknowledge all the hard work that you will do as we go through the transition. In the beginning of the week, it may be very challenging, but by the end of the week, we hope that everyone is feeling more confident as they go through the Go Live week. We do know that we will be looking at additional support for week 2, and we'll be looking at the areas that are most in need of that support. We recognize that some of our staff have used Epic before, and this may not be a big change for them, but we also know that we have many staff that this is a brand new endeavor. So I just wanted to share what our support plan is. And again, if you have questions, please reach out, let me know, let Joey know, and we can provide you more information. I did want to share a couple of other exciting things about Epic. So I was very fortunate, myself and Dr. Moore got to travel to Wisconsin to the Epic campus, which I would liken it to the Google campus. It was huge. There are 12,000 employees that work on that campus. And I didn't know this, but the Epic EMR actually started in 1979. So it's been around for a while, but it was quite impressive. But I learned a lot of really interesting things while I was there. And one thing is there's a lot of resources in Epic that we're not used to having. And so we will be initiating a new program, which is part of Epic, called Hello World. And that will replace our Health Assist, which has some bumps in it and bruises because it doesn't always help us the way we want it to. And so Hello World is going to give us an opportunity to better communicate with our patients and allow our patients to register, check in, pay, all those kinds of things in a more streamlined process. The other thing that's really awesome about Epic is MyChart. And a lot of you are probably familiar with MyChart because you yourself probably have signed up. It is key that we encourage all our patients to sign up for MyChart. It not only gives them more information, it makes our jobs easier. So each time you see a patient, regardless of what position you're in, encouraging them to sign up for MyChart. And I know our communications director, Bobby, is going to be sending out information to you to make it easy for our patients. And so please, if you can't think of another word, it's MyChart. So the last thing I wanted to share, I found a couple of really exciting things when I was in Wisconsin, besides that it was super cold. I was so happy to be back in Florida. First of all, there are some resources in there that are really awesome for the providers. There's a program within Epic called Cosmos. And Cosmos offers you the opportunity to connect with other providers across the country related to medical conditions. Very, unusual and rare conditions. And it also provides connections for, best practices and treatment options and outcomes. Finally, one other thing that I wanted to share is that there's a lot of work from Epic around AI, which might sound a little bit scary for folks, but there's a lot of opportunity for us to use that to reduce the number of times that our patients have to call in or wait on the phone. We want to make it better for our patients and for our employees. So as we move forward with this Epic Go Live, please ask questions. And it is so important to support each other during this big change. Epic is epic.